I'm Russ Mitchell. Laura is off tonight. Since almost day one of the pandemic, we've been hearing the phrase flattening the curve, a condition that would, in part, keep our medical system from becoming overwhelmed. With the number of cases going up, our Mark Naymik took a look at how hospitals are doing.
Ohio set a record on Friday it never wanted. 1,525 newly reported coronavirus cases, the most since mid-April. It pushed the 7-day average to over 1,000. Numbers from today and the weekend showing only a slight decline. 949 people were in hospitals, up about 75 from a week ago. Nearly 300 needing intensive care units across the state, though most severe cases holding steady. The state's more than 200 hospitals can handle the current patient load, says the Ohio Hospital Association's John Palmer.
We're seeing, capacity about 70% hovering over there. That's with COVID-19 patients as well as, emergency services, as well as elective surgeries and procedures occurring.
Each day, hospitals are supposed to report their COVID cases, including the number of patients in intensive care and on ventilators, to the Ohio Hospital Association. It sends the data to the Ohio Department of Health, which is the ultimate gatekeeper of the information. Exactly how many hospitalizations will trigger alarm among the governor and health officials is unclear. But extra hospital capacity is already available in the event of a surge. In March and April, the state worked with hospital and others in Cleveland, Columbus, and Cincinnati to create space and plans for additional beds.
Everything seems to be being managed well from the hospital standpoint, from a capacity standpoint, a staffing standpoint. But again, with the pandemic and COVID-19, that can turn on its head in an instant.
The Ohio Department of Health is also watching closely the positivity rate. That's the number of people testing positive each day for the coronavirus versus those being tested. Now, its recent rolling average has been on the uptick, though down from its peak in April. Mark Naymik, 3 News.